Hello and welcome to the CAPE training program. My name is John Leatherman. CAPE is short for Community Assessment and Education to promote behavioral health planning and evaluation. This training and related activities was sponsored by the Substance Abuse and Mental Health Services Administration, the U.S. Department of Agriculture, and the USDA network of regional rural development centers. The objectives of the program are to enhance behavioral health literacy by offering the Mental Health First Aid Workshop with an emphasis on substance abuse. Our second objective is to motivate the creation of community coalitions to address local behavioral health needs, such as those related to the opioid epidemic. Finally, we are encouraging the notion of formal action planning to create a community roadmap for improving the local situation. This will be the first in a series of videos that cover a host of community development principles and practices. We've tried to be very comprehensive in our coverage. If you've done much work in your communities, you will already know much of it. Some of it is common sense. Some of it you've figured out on yourself. But we think everyone will learn some new ideas and strategies, and that you'll have greater capacity to help your community to respond to its challenges. We're going to begin by talking about community needs assessment. That is, gathering the information necessary for the broader community to see the needs that exist and to determine the priorities to address. In this section, we'll discuss gathering government behavioral health data from the internet, preparing and communicating the information obtained to community leaders in the broader community, and gathering primary data from within the community, and structuring evidence-based arguments to strengthen proposals and recommendations. We'll begin by talking about how community leaders tend to use information to determine community behavioral health needs and priorities. The CAPE project was an integrated research and educational initiative. Early in the project, the CAPE team recruited representative communities from around the United States to conduct research. One of the questions asked early on was, how do community leaders currently obtain information about local behavioral health needs and concerns? Surveys were conducted in the dozen or so communities that had been recruited. We identified community leaders representing health services, social services, community organizations, and elected and appointed government officials. We found that while different types of leaders utilized different sources of information, there was typically general agreement on the problems and the priorities that existed. There were differences, however, in how serious the problems were viewed. In general, health services leaders utilized state government statistics. Elected officials depended on staff to tell them what was important. Social service representatives listened to their clientele and stakeholders. Community organization leaders tended to listen to what was reported through the local media. In general, local leaders make very little use of the data gathered by agencies of the federal government, such as SAMHSA and CDC. To utilize these types of data, there needed to be an intermediary in the community, such as an extension educator, to help access, package, and interpret the available secondary data. This brings us to the question of what secondary data related to behavioral health is available for our use. We spent a lot of time looking for information and set up a website to organize what we found. The website is at www.healthbench.info. It would take hours to cover everything you'll find there. Instead, I'll encourage you to spend some time there familiarizing yourself with the resources. Of course, as soon as you set up a site such as this, something changes and you have a dead link. If you run into that, I'd suggest doing a search for the name of the data source or the program listed. We tried to include all of the generally available behavioral health data we could find, including beefing up information related to opioids and substance abuse. Almost all of the data you'll find is organized at the county level. So when we're talking about community needs, we typically use county data as the proxy. The resources are organized into 4 broad categories. These include databases of programs and interventions, public studies and health data sets, general tools and guides for addressing community health, and guides to determining what is an evidence-based intervention. My own assessment of the web-based data available is that there is both more data than you might think, and there is less data than you hope to find. While there are many sources available, most of it reports much of the same information. Most of that comes through a survey system set up by the Centers for Disease Control called the Behavioral Risk Factor Surveillance System. Other major contributors come through state departments of health. Depending on a state, you may find some good resources specific to an individual state. Across all of these sources, there is a great variability in the accessibility of the information. Some data are spreadsheet ready, some are only available in PDF form, making it less user-friendly. And for some, you'll need advanced statistical and data analysis skills that few of us possess. In general, you'll find more data on topics like adult depression, alcohol abuse, tobacco use, teen pregnancy, and a lot of information about the welfare of Medicare beneficiaries. You'll find little available information about local mental health, local substance use and abuse, and local abuse and neglect. Spend some time checking out the resources we've identified. Once you've gathered the data you want to use, it becomes a matter of packaging it in a fashion that communicates its meaning and importance. When communicating with community leaders or the general community, that is frequently done graphically. Here are a few of the general principles I use when presenting data to a community. First, I think many people overestimate the extent people are able to understand the meaning of the data we present. Many of us have been trained to scrutinize data, but that isn't true of most people. When I present any sort of graphical information, I try to answer 4 questions. First, I identify what the information is. I say why the information is important. I spell out how to use the information. And finally, I identify where the information came from. Where possible, it is preferable to include some sort of a reference point against which the community can compare itself. You might show a community value compared to the state value, the nation value, or the value of similar places. This will help people to see whether their community is more or less, or better or worse. Finally, since pretty much everything is survey-based, there is frequently a problem of small numbers. Many rural areas will have missing values or huge confidence intervals. A few additional thoughts about presenting data. I always presume a relatively low level of data literacy in the audience. Keep the display as simple as possible and use simple and clear labeling. Finally, I strive to present the information in a fashion that allows the audience to capture the point within seconds. One of the resources we've created through the CAPE program is this guide to creating data graphics. This guide is available on the CAPE website. I'm going to show a variety of different types of graphics. This guide walks you through the process of creating them for yourself in an Excel spreadsheet. The guide provides step-by-step instructions for creating a variety of graphics. Bar charts are the typical choice when data are limited. This sample shows 2 points in time, but in addition to the community, it offers reference to both state and national numbers to provide important context with which to judge the community situation. More data points over time provides a better indication of whether conditions are worsening or improving over time. People tend to like this type of graphic. It's a single point in time, but it offers a normative dimension to show the relative urgency of the situation. Scatter plots are a good way to summarize a lot of information. They can show multiple factors, relative severity, and trends over time. This is another type of summary graphic. It's fancy and captures a lot of information, but I believe that people tend to have to work too hard to understand what they are looking at. If they have to work or it takes too long, they will frequently give up and shut it out. Then the opportunity to convey information and meaning is lost. In the next video, we'll continue discussing community needs assessment by talking about gathering primary data in the community and formulating evidence-based arguments. From there, we'll move on to assessing community preparedness, building community consensus, and community action planning. After viewing all the videos, we'll conduct a webinar to discuss community organization and planning. Here's our contact information. Thank you for watching.